Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Chronic meningitis. Now, in the chronic meningitis, there is chronic inflammation of meninges is seen in chronic meningitis. This chronic inflammation of meninges provides profound neurological disability can occur in chronic meningitis. So this in chronic meningitis, whenever there is chronic inflammatory meningitis, this results in profound neurological disability which can be fatal. Here in chronic meningitis, the patient will present with the patient might have characteristic neurological syndrome will develop for more than 4 weeks. And this chronic meningitis is also associated with persistent inflammatory response to CSF. It is associated with persistent inflammatory response in CSF, that is white blood cell count is more than 5 per ml. Then there are 5 diseases. So in chronic meningitis there are 5 categories of diseases which will result in chronic meningitis. So these include, there are 5 categories of diseases which can result in chronic meningitis, like meningeal infections or malignancy can result in chronic meningitis, or non-infectious inflammatory disorders, chemical meningitis, parameningeal infections. So all these are the 5 categories of meningitis which become chronic meningitis. Then here in chronic meningitis, infection will spread mainly from the subarachnoid space. From the subarachnoid space, it spreads to the brain parenchyma. Okay, from the subarachnoid space, it spreads to the brain parenchyma via the arachnoid cuffs. Okay, and then it penetrates the brain tissue. In the brain parenchyma, it will penetrate the brain tissue via the Virchow-Robin spaces, and thus it causes inflammation of the meninges, and then when it spreads into the brain parenchyma, it will result in encephalitis.
thank you and thank you for watching.